Good morning. I am delighted and very, very pleased to welcome you all on behalf of the Maternal and Child Health Integrated Program, which is a USAID-funded program. It is USAID's global program working in over 35 to 40 countries. And our mandate is to really help to scale up interventions that we know work to save lives. The MCHIP program is implemented by JPIGO in partnership with Save the Children, JSI, PATH, ICF Macro, Broad Branch, Johns Hopkins School of International Programs, and PSI. And we work in these country programs side by side with the host country government, NGOs, professional associations, to take the action around the interventions that we know work and how do we make sure that they are scaled up. Now, I feel very personally responsible that I in the MCHIP program stands for something. As you know, the I is the integration. And I'd like to share a personal story as why that I is so important for me. So I was a student at Johns Hopkins when I was pregnant with my youngest child. And I thought no better institution than to deliver at Johns Hopkins University Hospital. So I went into labor and I had prolonged rupture of membrane. And I was in the hospital for over 12 hours in labor, not delivering. And after 12 hours, I developed high fever, chills, and rigor, so which meant that there was going to be a very possible transmission of that infection to the newborn. And I had to come back after a cesarean section. I went back home, but my newborn had to stay in the hospital for 5 days to get the treatment for preventing newborn sepsis. So if that had happened to somebody in the field, a woman in a rural area, not recognizing the infection that could be passed on to the newborn, which is why I feel so responsible for making sure that we are looking at all the different ways that we can prevent newborn mortality. And yesterday, MCHIP had, and we all had sponsored a nutrition seminar that looks at maternal nutrition and how it impacts newborn health. We are going to have sessions that are devoted to looking at malaria and pregnancy, maternal anemia. And yesterday I was so delighted to hear the Honorable Minister talk about what South Africa had done in terms of preventing and eliminating mother-to-child transmission. So it's congratulations to South Africa and other countries that have succeeded in making sure that no infant is born with the HIV virus. So we at MCHIP want to make sure that we are able to support countries. And we know that there are still 1,000 days to help countries meet their MDG goals. And we know that what it would take for us to take the newborn interventions that we are simple, cost-effective, and safe, and can be delivered at the household, community level, or at the hospital, and can be done by a variety of health workers. So what do we need to make sure that it happens in the countries that we work in the countries that are trying hard to achieve and work towards the Millennium Development Goals? I think there are just 3 things that I would like to say. If we had and worked towards making sure that we have political will, program action on the ground, and empowered communities who know when to seek care and how to seek care, we can make the difference in making sure that no newborn dies from an intervention that we could have prevented, and we could have made sure that they got so that they would have survived. So I just want to make sure that we are here to learn from each other, take back some of the learning and adapt it to our country settings and work towards preventing newborn deaths in our countries. Thank you.